Today's topic and panel discussion was focused on influenza. So today we're going to do that. We're going to talk about influenza and why the right vaccine matters in our older adults. And when I say older adults, I mean those over the age of 65. I have worked in vaccines and immunizations, as you heard earlier. So I have talked for several organizations, but today is an unrestricted educational grant, and it's going to be reflecting our national guidelines on vaccines. Today, we're going to be talking about what exactly is influenza, and we're going to take a chance today, and we're going to actually dig in a little bit into what influenza is as a virus and as a disease. Oh, disappeared. Hello? So what it is as a virus and a disease and how it affects our human bodies in ways that maybe we don't realize. So some of our slides are going to be quite scientific behind me, but I promise I'm going to be presenting it in a way that I hope you'll be able to take home new knowledge or information about influenza that maybe you hadn't heard before. So when we look at influenza as a virus, it is a drop. We all know how it spreads. A droplet, someone sneezes on their hands, they touch a doorknob, someone else touches the doorknob. All they need to rub is their eyes or their nose, and they can get influenza. It's just that easy, and that's why good hand washing technique and prevention is so important. We know that influenza spreads much more easily in environments that are closed. So when lots of people are living in a single place, like an apartment or a condo or a long-term care facility, or when there's multiple caregivers coming in and out of our homes or places of living, our risk of influenza is higher. The other reason why influenza is significant is because it has a bigger impact on people as we age. It's because of a condition called immunosenescence. Now, that's a big word and it's kind of fun to say, immunosenescence, but what it basically is the natural process of aging that occurs as we get older, right? So as we get older, we all age and we all get more likely to have more significant infection, but we also have a decreased response to vaccination. And before I jump into that, I did want to take a minute to kind of explain or show you what influenza is, because I find a lot of people don't talk about what it actually is. Oh, with the mic, do you think would it be better for you to hear me if I'm standing? You can hear me okay? Okay. So when we take a look at influenza, I did want you to know that when we make our vaccines, we make it based on a single protein that's on the surface of the virus. And that, for short, we call the H protein. And that H protein is what we use to make our influenza viruses. But there's actually two different kinds. There's influenza A and influenza B. And the reason I think it's important to know this, not from a scientific perspective, is because in the media or in our environments, we often get different information like, oh, the bird flu is circulating this year, or influenza is a swine flu, or that it's influenza that's only affecting the kids this year. And the reason why we get that information is because we're often getting just a bit of the information around influenza in our media. And it's sometimes good to know and understand what that bigger picture looks like. Influenza A is the big bad influenza. It's the one that can cause epidemics or local infections or pandemics, the really big worldwide infections, right? And the reason why it can do that is because it can transmit both in animals and in humans. So it can go back and forth between birds and humans or swine and humans. So it can change a lot more. It has a lot of different types and subtypes, and that's why it's the more significant influenza. Influenza B is only transmitted in humans. So we only transmit it amongst ourselves. And it is one that we often see more commonly in kids. So that's why you might say, oh, we have an influenza that's circulating mostly in kids this year, right? Oh, good job. Perfect. Is that a little bit better? Wonderful. So do you need me to repeat anything I've already said? Are you feeling good? All right, perfect. So when we look at the types of influenza, it's not that I want you to become a scientist, but it's kind of nice to know why we have these two different types. And influenza A has so many different types because it's transmitted between animals and humans. those different types have impacts. So there are years that those impacts are higher or lower. The big take home is that influenza A years, in particularly the H3N2 years, are the most significant years for seniors. So even though we get our flu shots every single year, there are certain years that certain strains of influenza A are circulating. And the World Health Organization tries to adapt and select the strain of influenza they pick for the flu shot every year. Determines it based on what's circulating around the world. But on those H3N2 years, we know that our seniors have a higher risk of hospitalizations and in death. In fact, it can be upwards of 10% more than we do on other influenza years. So when you start to hear news in the media about circulating influenza A or what strain of influenza A is circulating, it is valuable to kind of note that it's because of these things that I'm talking about today that they're saying, they're telling you why it's higher risk or lower risk, right? Because influenza B, you've all likely seen it before in your life because it just circulates amongst humans. So therefore, it's less severe in seniors. So influenza A years are the most important years for risk. When we look at influenza A, this slide just shows that 83% of the risk that our seniors carried on an H3N2 year was influenza A. And sometimes it's hard to identify if we have the flu. So I wanted to talk about the symptoms of the flu, right? It's so hard, not just for you, and your healthcare professionals to determine exactly what the cause of your chest cold, your runny nose, your cough, your fever. And sometimes it can be mixed up with a cold or COVID-19 or even RSV, which now we have a vaccine for. So it's really important that the only way we can really tell what you have is by doing a swab. But we also want to be aware that influenza is different than a cold. It's more than just a cold. It is more significant. It causes a lot more fatigue and pain. And in its worst case scenario, it can lead to pneumonia. So we know that there's a relationship between pneumonia, which is a bacterial infection of our lungs, and influenza. So people get influenza, then they can get a secondary bacterial infection. So when you talk to your healthcare professionals, they're often going to talk to you about influenza and pneumonia, and they are two very different things. We're trying to protect you from both, right? So when we take a look at influenza, the other thing that happens as we age is our body responds differently to influenza. So the older we get, the less our symptoms are prominent. So, when we're young and we get fever, chills, and flu, we know we have the flu, right? As we get older, we maybe don't have as much of a fever. Maybe we don't have as much of a shortness of breath. So maybe we don't think it's as serious as it is, but it is in fact more serious. I would even go as far as to say more serious. It's very serious when we have influenza. It's important that we recognize that the symptoms will not be as prominent when we're older, particularly after the age of 80. And so that speaks to why we need so much good prevention and why you having our vaccinations and preventing influenza is so important. And the real idea around influenza that I want you to take home is that influenza is really under measured. So we have a lot of people that get influenza that don't go and get swabbed, that don't go to the hospital, that don't get identified as having influenza. We had 55,000 cases of influenza last year. And of that, that's just a tip of an iceberg in terms of the people that have actually had a negative outcome from influenza. Because what we'll hear in today's presentation is that it's not just about the typical symptoms of influenza. Influenza can cause other things to our bodies. It can cause inflammation that can affect our hearts, our kidneys, our diabetes. And so we want to make sure that we're preventing it for lots of different reasons. When we get influenza, we're in the hospital for about 10 days. And unfortunately, about 10% of those individuals will pass. And so it's really important to recognize that once you're in the hospital with influenza, there can be significant negative outcomes. It is a significant infection. And unfortunately, our seniors carry a large aspect of that burden. So when this study was done, 17% of Canadians were over the age of 65. Today, 19% of Canadians are over the age of 65. And so when we look at the number of hospitalizations back then, when it was 17% of the population, 62% of that population was in the hospital. So the vast majority of our hospitalizations are people over the age of 65. So it's a reason that we want to focus vaccination in this adult age group, right? And also, it's so important whenever I talk to individuals about how they're enjoying their retirement. What do they want? What are they most worried about? And it's always about the loss of their independence. I want to be able to live my best life. I want to see my friends. I want to do the things I want to do at this stage in my life. Influenza takes that away from people. People who end up in the hospital, about a third of them end up in long-term care after the fact. It is so important that we recognize that prevention isn't just preventing disease, it's preventing hospitalizations, it's preventing going to long-term care, it's preventing the frailty that comes with being stuck in our bed for 14 to 20 days, right? We don't want those things. We become more susceptible to having those things really impact our health as we age. So that's the reason why influenza is so significant in our older adult population. When we look at that cool word, immunosenescence, that I mentioned earlier, I wanted to make sure that we talked about why influenza is so important as we age, and why it's so important that we prevent. Because as we age, that natural process of aging, it increases our risk of having significant infections. It also decreases our immune response to vaccines, right? So that's part of the story of why the right vaccine matters. And we're going to talk about that more as we go through these slides. And as we get older and the population gets older, we want to try to reduce the amount of time we spend in the hospital or use those healthcare resources. So it's also incredibly important, not just from a personal health perspective, but from our whole healthcare system, because we want to ensure that as we have this aging population, that we have enough room to provide the care to people who need it. And this essence of immunosenescence, this feeling that as we get older, our body is less able to fight infection, we don't just see that with influenza. This is a shingles vaccine chart. And all I ask to take from it is that, see how it goes? It shoots up right at age 50. The reason it does that is because after we get a certain age, our ability to keep viruses asleep goes down, and we have an increased risk of shingles. So when we say get your shingles vaccine at 50, it's because at 50, we know we start to see a really fast and significant increase in risk. That's because of this immunosenescence, right? So we have data not just with influenza, but with a lot of our adult vaccines around why we want to actually ensure that you have that prevention in place. And when we talk about vaccines and how they don't work as well in seniors, this slide shows you what happens when we give a standard flu shot to someone over the age of 65. What happens is that there's this gap that develops. So this is over 5 seasons. Individuals on a standard flu vaccine will, on average, have about half the immune response than someone who's a young adult, right? Before the age of 65. So a young adult that's not 65 compared to someone who's over the age of 65, our immune response is about half. And so we're really not able to protect them as well because of this natural process of aging. So we need to have vaccines that bridge this gap, that narrow it, that allow us to actually protect our seniors over the age of 65 that are at higher risk. And we do that by building vaccines that do that. So who here has had the high-dose flu vaccine? So the high-dose flu vaccine, I'm going to talk about it in a minute, and that's a response to how we bridge that gap, right? That's why we no longer use that standard flu vaccine in our adults over the age of 65. When we look at getting older, our risk increases not just because of that natural process of aging, but also as we get older, we start to gather chronic medical conditions. Be diabetes, could be high blood pressure, could be gaining weight, right? Could be COPD. And as we age, those chronic medical conditions put us at increased risk in addition to our age. So when we look at this data, at least half of adults over the age of 50 have at least one chronic medical condition. So, and some maybe 2, 3, 4, 5 even we see in practice. So those things do increase our risk and are a reason why we want to try to prevent influenza. This is an interesting graph, and what you want to take home from it is basically that we can have a medical condition, say diabetes or heart disease or COPD, our whole lives, and our risk would be about here, right? But once we hit 65, that risk doubles just based on our age. So I'm just kind of really stressing that it's not just the diseases or the chronic medical conditions that we have. It's actually our age that also increases our risk. It's that immunosenescence on top of the medical conditions that we have. So we always want to think about our risk, not just in one way, but in both ways. Does that make sense? The other thing I would think is really important to take home today is that influenza doesn't just cause the typical runny nose, cough, fever that we would associate with the flu. It can cause all sorts of things in the human body. And a lot of people don't realize that influenza is what we would call an inflammatory virus. It increases the inflammation in our body. It causes things to happen that can be very significant, particularly when we're seniors over the age of 65 with 1, 2, 3, or 4 chronic medical conditions, right? So when we look at that inflammation, it goes beyond just our lungs. It can cause the swelling in our veins and arteries to be more significant, and it can cause things like heart attacks and stroke. In fact, what we know to be true is that the risk of heart attack 7 days after influenza is 6 times higher in adults. And if you're over the age of 65, it's 7 times higher, just because you had influenza. We know that diabetes gets exacerbated and not well controlled. We know that kidney function can be significantly impacted just by having influenza, just by having the infection of influenza. So it's another reason why we want to try to prevent as much as possible. And it's not just influenza. This is just a small snippet to show that it's other inflammatory viruses as well. Things like shingles, things like RSV also have an inflammatory impact on the human body that can increase our risk. So when you see your healthcare professionals talking about prevention medicine, like preventative medicine, they're doing this because they know that there are outcomes that go beyond just the infection that are more significant, and we want to try to prevent those as much as possible. And in the end, what we're trying to do is break this cycle of, if you have a chronic medical condition, you have an increased risk of getting an infection. Once you have the infection, it has negative outcomes. You can't always get back to 100%, which then, of course, increases your risk with your chronic medical disease, and it ends up in a cycle. Vaccines break this cycle. They prevent us from having to go through this cycle. And I think that's the main value of immunization. Now, I know my panelists today are going to be talking a lot about the vaccines that we're using for influenza. So I just wanted to touch on them briefly so that I kind of can complete the story, but I know they're going to be going into it with more detail. What we want to be aware is that influenza vaccine does work. Sometimes patients or people will ask me, it didn't work this year. Or I hear that it's not a good match, or I hear that this vaccine isn't working. And what I want you to remember is that there are years that are good matches and there are years that are bad matches, but I strongly recommend you get your flu shot every single year because it does work. It does impact your overall health. And we have data that supports that. What we know is that even getting your vaccine in the last 5 years will reduce your cardiac risk significantly. So we know even if you're getting your flu shot, whether it was a matched year or not, you're still getting better outcomes from a cardiovascular or heart perspective than we would if you hadn't. And we also know that vaccines work because our 65 age year group, they're amazing. They always go and get their vaccines. So our target rates are about 80% for 65 plus for flu shots. And we get about 70% of 65-year-olds in Canada get their flu, right? But unfortunately, our 50 to 64-year-olds are not as driven to get their vaccinations. And they often think they're still young, they're just retiring, they're thinking about what they want to do with this stage of their lives. I've just got diabetes, it's well controlled, I'm still young and I'm still healthy. And they often will choose, well, not often, but they have chosen sometimes to not get vaccinated. So their vaccination rates are much lower. And what we see is that group now has higher hospitalization rates than our 65-year-old plus group, solely based on the fact that they're just not as vaccinated. So we know that vaccines work. We know they improve, they save lives. We know they keep you out of the hospital. We know, but we do need to understand that they have value not just in preventing disease, but also making sure that we're giving you the best protection possible for our seniors. So how do we address this little gap that I was talking about earlier from vaccines? It's that high dose flu I was talking to you about, and there's actually another vaccine that we have now that will do that as well. There's 3 ways, in fact, that we can actually address that gap we see in seniors for standard flu and what their immune response is. The first is to give a vaccine that has more of the immune antigen or protein in it. So high dose flu is called high dose flu because it has a higher amount of the flu immune protein in it, right? So it's more likely to cause a positive or stronger immune response, therefore fills that gap and ensures that you have that protection, right? So that's why we use high dose flu in Alberta. The other way to do that is to put an adjuvant in it. An adjuvant is an irritant that is in the injection that causes the body's immune system to go and have a stronger immune response at the site of injection, right? So those are two ways we can actually improve a senior's immune response to vaccination. The last way, which I've put a little line through, is a different way of administering vaccines, but we don't typically use it. So I'm not going to talk about it. So this year's NACI guidelines, which you'll be hearing about from my colleagues this year or today, is that are approving both the high dose influenza vaccine and the adjuvanted influenza vaccine as a priority for seniors over the age of 65. Over the last 15 years, we have seen what did I say 15 years? I meant since 2015, we have seen the use of high dose flu in our seniors. So this year, there is going to be two flu shots in play. Well, there's a couple others, but two main flu shots in play for our seniors. But it is the one that you received in the past is the high dose flu. And then there's the adjuvanted flu that may also be made available to you this year. So we know we have a lot of body of evidence around the high dose flu, so it's not wrong for you to ask which flu shot I'm getting this year. You may want to ask, especially if you're the type of person that prefers to have a flu shot that you've had in the past, but it is be aware that there will be more than one seniors-based influenza vaccine available to the public this year. And that's just to address this risk. And I'm going to kind of end it there because I know that my colleagues, we don't want to overlap too much. So I want to make sure they get the opportunity to talk about the vaccine a little bit more. I understand that we've changed the format today, so we're not going to do questions right now. But hold on to your questions. I'm going to pass it on to our next speaker, and then we'll do questions at the end. Okay?
Immunizations years? I didn't know that there was, do I have to sit down? Wow. It's like a fantasy of nobodies for me to have two microphones. Okay, I'm sorry about that, folks online. I didn't, yeah, wow, okay.
If you want to stay, you can just go there and I can help you with the pages just to
No, it's good.
change it.
Yeah. All right, so this is a dog. Let's see what I'm talking about. I know how to, oh, good. All right, pop quiz. I think I had a disclosure slide there too. So I've done work with all of the vaccine companies. All right, pop quiz. How many pharmacists got vaccinated last year? Well, the ones sitting at this table. So what do you guys think? A, B, or C? What percentage of Albertans got vaccinated last year? Did you give them the answers, Anjli?
Not.
Okay, you guys are spot on. It's one of the lowest immunization rates we've seen in our province in over 2 decades. All right, more cute animals. This is our learning objectives. So one of the big things is where do we get information? And we've got some pharmacists on the panels, and that's who I'm going to emphasize as where to get information. Do you know how to get it? So in case you... Technical. Sure. Got my AV person here trying to help me. I'm in my immunosenescence years now. What that means, so over 50, your immune system. So it's immunosenescence basically means immune system is falling asleep. And I'm in those years now, which is really delightful. All right. So this is what we're going to be looking at. And then I've got a funny slide here. So a little cartoon. Might have to read that out loud. We particularly saw this happening with the pandemic. People were very selective about how they were getting vaccinations, yet nobody wants to be told what to do, but they expect that everybody else will cooperate. All right. Here's another picture. So as I was sitting in the airport heading to Toronto a few months ago, I saw this news bulletin come up, and that's the slide, the picture on the one slide. And I took the picture. It basically said, we've had higher cases of influenza in Alberta than we have in 2 decades. Kind of matches the fact that we have low immunization rates as well. And I took this picture in such a hurry, because it's embarrassing, that it kind of looked like a Portuguese water dog in the picture. So I put Charlie there too. Rest in peace. So these are the stats from last year. I think Anjli kind of touched on that. And I kept them from this past year plus the year before that, just to see the absolute increase. So we went from having about 10,000 lab confirmed cases of influenza 2 years ago to 16,000 last year. So huge leaps. And you can see the hospitalization rates, how they increased, and the ICU rates, how they increased. And I think the one that strikes me the most is the deaths. 175 people died of a vaccine preventable illness last year. And I think I'll just back up the truck to the ICU and hospitalization piece and piggyback off what Anjli said about frailty and talking about independent living. So death is a bad outcome. But going into hospital, especially into ICU, usually under sedation, like medical coma, you're going to have a loss of independence on the other side. And from what I understand, that scares people more than death itself, right? Your ability to do your daily living stuff. All right, so this is some idiot with a Gibraltar ape on her back. That's me. Years ago. All right, so where do you get your information? From us. So pharmacists, we're great access, and we're going to talk about some high-risk groups. So I've got some high-risk groups on this slide, and then I'm going to ask, before I flip to the next slide, some of the other ones. Anjli talked about comorbidities or kind of diseases that people can get. So pregnant women, any stage, anybody over 65, higher risk of bad outcomes from influenza, anybody that's in a chronic care facility, and little kids, and Indigenous folks, and people with chronic health conditions. So what do you remember from chronic health conditions from Anjali's talk? Anything? Age 65? That puts you at higher risk of getting flu and bad outcomes. What other things? Some of the diseases. Diabetes. Sorry? Cardiovascular disease, so people with high blood pressure. So, and a lot of people have that. So a lot of people have high blood pressure, they have high cholesterol, or they have diabetes. So flipping to the next slide, here's some of the things. And one of the things that Anjli said that sometimes doesn't get talked about is obesity. So high body weight can also put you at higher risk of bad outcomes. Any sort of dysfunction as far as kidneys, heart, liver. And then we have people in healthcare settings, people that are healthcare workers, people that have take care of young kids. So these are a couple of slides on who's at high risk. If you don't identify yourself in those slides, you probably have somebody in your life that is on one of those slides. Is that fair? Yeah. So this has been my comment about influenza vaccine for as long as I've been able to administer it. It's, you may not be high risk, but you have somebody high risk in your life. So it's not just about protecting yourself. It's also about protecting your herd, right? Protecting your family, protecting your grandkids. And one of the things about infants is that they can't get a flu shot until they're 6 months of age. So newborns up to 6 months aren't able to get protection from influenza through vaccination. So it's really about everybody in their lives getting vaccinated. And that's true of other vaccines as well. So here's our immunization rates. They went down last year significantly, and talked about the percentage of seniors that usually get vaccinated and that went down by about 5%. And Anjli mentioned that that's kind of our stronghold, is people over 65 getting vaccinated. People appreciate the not only kind of the back outcomes that they could have, but they probably have a history of seeing somebody have influenza to the severity that they've gotten hospitalized. And also, vaccines are kind of their own worst enemy, in the sense that success of vaccinations has made people forget a lot about things that have happened in the past. And I'll have a slide on that little baby too. The two vaccines that are publicly funded this year are ones for 6 months to 64 years of age, and it's called Flu-Selvax. And then the one that is publicly funded for you folks, or I'm assuming something, I shouldn't, for other people, 65 plus is a high dose flu. So Anjli talked about that, and it's kind of got 4 times the dose that we have in the regular flu shot, which is the Flu-Selvax. So when you go to your pharmacy or wherever you get your vaccinations done, you will likely get a high dose influenza vaccine. And it has been in Alberta off and on probably for the last 10 years. So likelihood you've had it at some point in time. All right, who recognizes that machine? Yeah. It is an iron lung. Yes. Horror stories. So this is an iron lung. What was that used for? Yeah, so people that got polio, a vaccine preventable illness now. And I've heard stories of back in the 1950s when the polio vaccine came out, that people were lining up at health clinics to get the polio vaccine, which at that time was pardon? Yeah. Yeah. So again, victim of its own success, people forget that we have circulating illnesses that are vaccine preventable, so we should get vaccinated against them. And then this next one, household contacts. So if any of you have grandchildren, especially grandchildren under 6 months of age that can't get vaccinated, it's a good idea for you to get vaccinated against influenza, also get vaccinated against RSV and pneumococcal and pertussis or whooping cough. You guys remember whooping cough? It's making a comeback too, because people aren't getting vaccinated. This picture is an orphanage that did some medical work at down in Guatemala. And I put that on there because, again, appreciate that it's not just about our protecting ourselves. We have to protect other people as well. So grandkids, kids, anybody that you live with, anybody that's in and around your space also needs to be protected. And some people don't have the advantage of being able to get vaccinated at their local pharmacy. This is a picture I took of this cartoon many years ago at the Canadian Immunization Conference. So that happens every couple of years, usually in Ottawa. Do you know what band this is? The Beatles. Now it's the measles. No, I don't think God was one of the 4, but maybe they were really talented. So this just, again, emphasizes the importance of being vaccinated. And this one is why people have hesitancy. And I think one of the biggest things is misinformation and where people do get their information. And trusting the people that they're getting the information from. So when you get your news, are you getting it from a newspaper? Are you watching local news? Or where do you get your news from? Or don't? TV? Local news, TV? Said Facebook. Somebody's trying to be funny. Facebook isn't news. So it's really important to get good information. And healthcare providers are good sources of that information. So one of the things that we want to do is make sure that as healthcare providers, or even this is a slide that can can be for you folks as well if you're talking to people who are a little vaccine hesitant, is to listen to their situation, appreciate what they're saying. It's no good and no fun to try to argue with people, but try to provide them with good quality information. And here's some really good websites. So you guys have a copy? You will have a copy of the presentation? Sure, of course. If you do like searching the web, I've got some reliable information from the Canadian Immunization Guide. There's a group called Immunize Canada that has both information for healthcare professionals and for lay people, and has great information on vaccine hesitancy. And then I've got some information as well from Government of Alberta Health, I should say. Not the Government of Alberta. Just as an FYI, you may not hear as much about flu vaccines as you typically do in the news, and that's because our government is not advertising the influenza program. They didn't last year, and they're not doing it again this year. This is getting recorded, right? Yeah, fill in the blank. Okay. So it is really important for us as healthcare professionals to get the word out. Pharmacy is one of the, probably the biggest thing. One of the slides showed the percentage of immunizations given, the flu shots given by pharmacy was well over 70%, close to 80%. Pharmacists will often, when you come in to get your regular medications and it's flu season, they'll say, do you want a flu shot? Do you guys have pharmacists that do that? Yeah. So as we're giving you this information, please be aware that people don't remember that it's flu season unless somebody reminds them. So October 15th is when flu season, the vaccines can be starting to give out to the public. If you're in a long-term care facility, you may get that a couple of weeks earlier than that. But please share this information with your friends and your family, and make sure that people are aware that it is influenza season starting Tuesday, October 15th, and that anybody 6 months and older is eligible for vaccination. Anybody 5 years and older can get their vaccine at a pharmacy. Fortunately, we don't have a scope underneath 5 yet. It's changing. And I'd really like to know who is responsible for getting that scope changed so that we can immunize as of this coming February, 2 years and up. You ever seen a 2-year-old get a shot? No, not easily or gracefully. So please share the message that influenza vaccine is available on October 15th, and get it as soon as you possibly can. And I will leave it there and pass. Yeah. Great question. So the RSV program was just announced a few days ago. What it will be anybody 75 years. 75 years and older will be eligible. Anybody, I think, over 60 to 74 years of age with certain conditions may be eligible for publicly funded vaccine. I do know the 75 plus for sure. And, but that doesn't start until October 21st. And here's the deal. RSV has to be separated quite a bit from other vaccines. For a flu vaccine, it has to be separated by 2 weeks. So if you get a flu shot, you can't get the RSV shot for 2 weeks. If you get RSV shot, you can't get the flu shot for 2 weeks. Other vaccines like shingles have to be spaced 6 weeks apart. So timing is everything. So I would get your flu shot as soon as possible. I think there's going to be, because the RSV program is its first time being launched, I think there's going to be some hiccups perhaps. So I think it would be reasonable to get flu shot as soon as you can in mid-October, and then pursue RSV a couple of weeks later. Keep in mind too that it's not just influenza and RSV that are respiratory illnesses. You also have pneumococcal, so pneumococcal pneumonia, and COVID-19. There's a new formulation of COVID vaccine that's coming out as well. And those can be given together, so concomitantly. I would space out, again, RSV has to be spaced out. Some people recommend spacing out the COVID vaccine from others as well. Yes. That's right. And that's cool. How did you get it last year? That's amazing. This hasn't even been around that long, but anyways, it's supposed to be a one and done. So you get it once and that's it. RSV. Yeah, so what they have, one of the vaccine manufacturers has 2-year data that shows that there's no real loss of immune protection after 2 years. Again, when we get these new vaccines, it's we have studies that are done, clinical trial studies, and then once they go out to the real world, then they start collecting real world data. And it's with that that we learn more. So at this point in time, it's one and done, but it might end up that you have to get a booster every 5 years. Who knows? That's a great question. RSV is respiratory syncytial virus. Syncytial virus. Syncytial virus. It's a respiratory virus that's been around. It was documented probably 50 or plus years ago. It's only now because there's a vaccine. There's 2 vaccines that are on the Canadian market for people 60 years and older. And there's another, it's a vaccine-like thing that can be given to infants. It's only because these things have come to market that people have the awareness. It's just a different virus. So it's got a different coat on. It's wearing a red coat. Influenza is wearing a blue coat. So but it has very similar signs and symptoms as do most respiratory viruses. Yes, when the timing is right. Any other? Yes. No, the only spacing is with the RSV vaccine. Yeah, because it's a new vaccine, there's a little bit of, if you get the vaccine, they want to make sure that if you do have any reaction to it, even if it's just fatigue, that we know exactly what caused that reaction. So there is no spacing needed for your shingles vaccine and your flu vaccine. How did you feel after your first shingles dose, if you don't mind sharing with the audience? Mm-hmm. Yes. So Anjli mentioned something called an adjuvant. It's kind of an add-on in vaccines. The vaccine that you got for shingles has that adjuvant in there. It makes the vaccine more potent, but it also makes you feel like crap. So what I would suggest, honestly, when I give a Shingrix vaccine, I will, it's usually people, I'll give it to them on a Friday so that they can ruin their weekend. So it's not like you feel horrible. You just feel tired and kind of unwell. It's like a perfect lay on the couch and watch Netflix kind of anticipation. So you can get it at the same time as influenza, but you may want to just space it, because I have heard anecdotally people getting the 2 vaccines at the same time, and kind of it exacerbates the fatigue and the unwellness of the Shingrix. Anything else? Yes. Chickenpox. Okay, so the question is, what is the childhood disease that then gives us shingles? Is that the question? Okay, sorry. So I think your question was, what is the childhood disease that people get that then goes on to be shingles? Yes. So that's chickenpox. So if you get chickenpox, the infection when you're younger, the virus lives on your nervous system. And then as we get older and we have that, our immune system starts going to sleep, immunosenescence, then the virus that's been laying around on your nervous system comes popping back up, and it's called shingles. So the only way that you can get shingles is if you had chickenpox infection. The vaccine for chickenpox has been around in Alberta since about 1995, and it became part of our program in 2001 for 12 months old. So anybody born after 2000 that didn't get chickenpox, the disease, likely would have got chickenpox, the vaccine. And then they will not be able to spread chickenpox. They will not be able to get shingles. They won't have the privilege of getting shingles when they're older.
That's easy. Okay, go ahead.
So remember that slide I showed you about the little H protein on the flu virus? The vaccine is made to just trigger the human immune system to have an immune response to the surface of the flu. So there is no live vaccine in the flu shot. So therefore, it cannot cause influenza, right? It is just giving the body the tools it needs to build the immune system to identify when influenza is present. That makes sense? Okay, next question. I'll add one more thing to that answer, is that the conjugated pneumonia vaccine covers 20 strains of bacterial pneumonia. And that bacterial pneumonia, that vaccine, those 20 strains, not everyone carries all those strains, but we can get exposed to them. So when we get that pneumonia vaccine, not only does it have a really long longevity, the guidelines are now being updated. And in Alberta right now, we're going to be having access to that conjugated vaccine for seniors over the age of 65, free of charge by the Alberta government. And there's value into it unto itself because it doesn't just cause that pneumonia of our lungs. It can cause other diseases that we're trying to prevent. So I just remember it's its own vaccine and there's value in it unto itself, not just because of what it prevents, but also because it has multiple strains in it that it's giving us immunity to. Yeah. Yeah. So I am presenting on November 13th, and I will be covering 7 adult immunizations. So all of the current provincial guidelines for all of the adult immunizations. This is a big year of change in Alberta. So our national pneumonia guidelines have changed. The Alberta government has decided to pick up those national recommendations. So we are in a process of transition. The RSV vaccine has become available. The Alberta government has decided and chosen which individuals are going to be able to access that vaccine and which aren't. After my 20 years of experience, I'll tell you the first year at the Alberta government covers a public health vaccine. It can often be difficult to find. So we want to make sure that we understand where we can get it, how we meet those guidelines. So I'll be reviewing those things on the 13th. So the first step is to get your flu shot. You can get your pneumonia shot if you meet the guidelines. I'll be talking about some of the finer points of why some people may not meet those guidelines and what they can do about it when I talk on the 13th. But again, it's part of that whole big picture. But yes, you can ask your pharmacist about it. She or he will be very aware of how these guidelines are changing right now, that things are up in the air. We're just entering that respiratory season. Make sense? Next question.
Shingles, can they get shingles again? And if they've had shingles, should they get the shingles vaccination?
Absolutely. So we'll be reviewing shingles at that next presentation as well. But to answer the question, shingles is a reoccurrence of the chickenpox virus. When our body, you'll have some people who will get shingles when they're 28, when they're 38, but most people get shingles after the age of 50. If we have shingles, there are medication we can use to reduce our symptoms, reduce the impact on our nervous system, because that burning pain that people get when they get shingles, we need to make sure we give medication to try and reduce that from being long-term and chronic. However, the shingles vaccine will prevent it from happening in the first place. So your first question is, can people get shingles again? Yes, because if their body didn't mount as strong of an immune response, the virus will go to sleep and then it'll wake up again, right? As that immunosenescence kicks in. If you've had the shingles, can you get the shingles vaccine? Absolutely, you can get the shingles vaccine. In fact, our national guidelines haven't been updated till since 2018, but across the world, you can now get the shingles vaccine after that acute phase of shingles is over. So after this, it's crusted up and your symptoms have abated, we can vaccinate you against against shingles. It's not going to hurt you. So, and then that actually primes that immune system at a higher level, hopefully then keeping the virus asleep for longer. That makes sense? Okay.